better now?
Yeah.
Okay. 4,000. How much sugar in your tea?
Assalamu alaikum, good evening. We're just about to go live on air in the next 30 seconds and we have a fantastic show for you today. We have got a GP, but not just a GP, but he's also part of the Birmingham Solihull Clinical Commissioning Group, so he can give us maybe something behind the scenes that is being done in terms of supply chains, in terms of strategy as well. So hopefully we'll discuss both. If you've got your questions, please get them in early. The studio number as always is 0121 682 9735. So we've got about another 30 seconds before we hit the airwaves.
Are you speaking English or Urdu?
Say again?
Are you speaking English or Urdu?
English. Maybe if you want to do the summary in Urdu as well, English and Urdu. Yeah. I have got another GP, Dr. Imran Hussain, in 2 weeks' time. The whole show is going to be Urdu. Or in Mirpuri actually. In Mirpuri, yeah.
आप मैसेज जो है ना अपनी उर्दू में दे सकते हैं, no worries, in the middle, वो जो मतलब है whatever.
वैसे हम गुजराती हैं.
कोई बात नहीं. गुजराती में भी दे सकते हैं. No worries.
We'll also touch on the Dr. Nuru as well. I know you were involved with that mosque as well. We'll talk about that as well. I've got him coming next week.
Oh, you have? Good.
Assalamu alaikum, good evening everyone. My name is Mr. Ali and today is a Tuesday as always when we hit the airwaves, and today is Tuesday the 26th of January. We're almost the end of the first month. Don't know where the time has gone, but as always when I start my show, I'm just going to go through the latest, walaikum salam, I'm going to go through the latest figures that we have for COVID nationally, but also here locally in the different wards, and then after that we'll touch on the vaccines. And today I have got Dr. Rizwan Alidina, who practices not too far from here, to talk about and answer any questions that you may have with the vaccine as well. So please, think about your questions, and we are going to address about why the Pakistani, the Mirpuri community in particular, are very fearful, and a lot of the brainwashing, a lot of the misinformation is now certainly taking the airwaves as well. So walaikum salam, Javed Akhtar, to you as well, and to Brother Nazir as well. So in terms of where we are seeing a downward trajectory. So this latest week, which is the 22nd of January, in terms of new cases, we had 6,674. That compares very favorably to the week previous to that, which was 8,308, which is a fall of about 1,600. So we're going in the right direction. In terms of rates of cases per 100,000 of a population, the week ending 22nd of January, it is 584 per 100,000. And compared to the week previous, that was 727. In terms of where we are, in particular with the wards, Lozells is still up there with the highest number of cases, which came in at 958 per 100,000, followed by Peribar 926 per 100,000, Yardley 907, Heartlands Ward and Borsley Green 881, Hodge Hill 853, and Ward End 749. Those were your top 6 or 7 different areas where they had the highest number of cases per 100,000 population. If you have family, friends, if you are living in those areas, please continue to maintain social distancing, wear your face mask continually, to wash your hands, and when you get your vaccination letter, please make sure you honor that particular appointment. sad news today. We have now topped the 100,000 figure in terms of total deaths since COVID was first reported. And 100,000, we roll off it from our tongues quite easily, but these are our family friends, our aunts, our uncles, our parents that have passed away. There's a name behind that, there's a story, there's a family that has been affected as a result as well. And in terms of what that means for Birmingham, we have had just over 2,000 people that have died in Birmingham as a result of COVID as well. So, we have a high percentage of ethnicity from the BME community, and that certainly played a huge part in contracting and dying from the virus as well. Good news in terms of the rollout, and this is one of the, I think, certainly the success stories over the last few months is not only has the UK managed to get the MHRA license for 3 vaccines, not 1, not 2, but 3. But we've now covered about 10% of our population, so just over 7 million people. And it is thanks to the NHS that, we can say that, the crown jewels that it is certainly stood up and counted once again, as it has done since the start of the vaccine. So there we are. But at the same time, before I introduce Dr. Rizwan, there's also economic cost to this coronavirus. And we've just had the unemployment figures. The overall unemployment figures is now topping 5% now, which equates to 1.72 million people. And the hospitality sector is the worst hit, with those that are between the ages of 24 and 35 the most severe affected. So first of all, thank you, Dr. Rizwan Alidina, for coming into the humble studios of Radio Awaaz. We are going to spend the next hour or so talking about COVID and the vaccine in particular. If you've got any questions, the number is 0121 682 9735. Please get your calls or your messages in. Alternatively, if you want to type in, I will do my best to read those out as well. So first of all, Dr. Rizwan, on behalf of Radio Awaaz and myself, thank you for everything that you've done, not just over the last 2 or 3 months with the vaccine rollout, but continuously from March and thereon, really. So, when you first COVID hit the airwaves, did you ever think that 2,000 people were going to be affected or die in Birmingham, and over 100,000 people were going to actually die across the UK? And what's actually worrying, Dr. Rizwan, before I bring you in, is I was looking at the latest 7-day figures, and out of all the countries in the world, UK tops it. So I think we are turning the curve, but it's still, because of these new virulent strains that we will come to, we aren't over the hill at any stage.
Assalamualaikum. Thank you very much for having me. Well, yes. This time last year, we were all coming back from our Christmas holidays and enjoying the new year. And here we are, a year down the road, where life has changed. If somebody said a year ago that people would be not coming out of their homes and people would lose their jobs and this number of people would die, we would be laughing at them.
Absolutely.
And we would be saying that they are doomsday soothsayers and so on. But it's become a reality, and it's here to stay, unfortunately.
Yeah.
COVID has hit everybody, and I can say this as an individual, but also as a medical practitioner. I do not know of many families who either haven't had somebody fall ill or lose somebody.
Yeah.
It has affected all our lives, and unfortunately, we're not over the worst yet. The peak of the deaths are still to come. We are projecting that to be either this week or next week, and unfortunately, the number of infections, even though they're going down, the number of hospital admissions are just about peaking as well. The NHS is at full capacity. It is holding, but it is under some severe strain at the moment. GPs are being asked to go to hospitals and help out. People from the council and other areas of local government are helping out in hospitals. So No, the situation is not good. I'm not going to lie about that. And the situation can only get better if we all follow the rules.
Absolutely. I think before we get into some of the intricacies of our discussion today, it may be worth just sort of giving your background as well as a GP, your practice, and also maybe your association with the CCG as well, and maybe just talk about briefly what is a CCG.
So a CCG is a clinical commissioning group. A clinical commissioning group is basically a group of doctors and a group of executive who look after the needs of the population. And our clinical commissioning group, or CCG as it's called, is the largest in the country because we incorporate Birmingham and Solihull. The function of the CCG is to look at the trends of health and disease and inequality, and then commission treatments and commission healthcare services across the community to meet that need.
Yeah.
So that's what the CCG does. I'm a general practitioner. I'm a GP. I trained in hospital as intensive care initially and then left and became a GP. But as part of my interest, I'm also part of the clinical commissioning group. So I look at population data. And I'm in charge for the GPs in the east of Birmingham. So this is where the highest number of ethnic minorities are and a younger population is. And we have our own health needs because of the population that we serve. So I help out in various ways in looking after the east of Birmingham and looking at needs and then influencing the decision making.
Absolutely. And I also want to touch on the bit about the CCG. They're also responsible for commissioning the services from the hospitals as well, from the trusts. And you mentioned about the impact and the pressures that our secondary care colleagues are under, or should I say the NHS staff are under. We have seen a 200%, beyond normal capacity that they've seen an increase. And in total in the UK, there are 37,000 people currently in hospitals as well. And I think that is where I find very insulting and very dangerous for people to go around to some of those, reception areas, some of those corridors where there's no one there. And obviously because of social distancing and because your normal elective surgeries, stuff like, your routine heart operation or your cancer, these have been maybe moved to other hospitals or, maybe sort of cancelled until we've managed to get a hold of COVID. These people are very irresponsible, aren't they? And trying to portray that this is a hoax. And maybe for someone who's got a bit, a first-hand experience, can you reassure people that they are people in hospitals? It's not a ghost hospital at the moment.
So I think there's a misconception that areas and equipment makes up a hospital.
Yeah.
The biggest asset of any hospital or any healthcare setting is actually its staff.
Yes.
And if you are going to a hospital and seeing an empty ward, that is probably because the staff in that ward have been moved to another area where there is a requirement. So, for instance, orthopedics, where haddi ka doctor, people who mend bones and do routine hip operations and stuff, they can't do their operations because the intensive care unit and the theatres are full of COVID patients who are being ventilated.
Absolutely.
Therefore, that ward is going to be empty.
Yeah.
But that doesn't mean that they are doing nothing. They are looking after COVID patients. The nurses are deployed in COVID patients. I mean, to the point that now we are looking at council workers helping out in intensive care and COVID wards. I think that has to say something. I think we are just about at breaking point. And I think we're coping, but I think we're getting there.
Before we go on to the vaccine bit, Dr. Rizwan, we're going to touch on this. At the end of sort of November, December, we were thinking we're now going to see the tail end of COVID. We've got a real stranglehold. Obviously, we had Christmas. We've had this now new strain that's coming, originated from the south of the country. We're talking about this new South African strain and from South America as well. And we've seen, the virulency, which is how fast it spreads, is, it's purported to have spread 70% more virulent than the original COVID, and it seems to be affecting more of the younger population as well. So I suppose just around that really, in terms of, is there a difference in the symptoms between the sort of the new strains of COVID and the original one? What can you sort of tell us about the new strain?
So it's the same virus.
Yeah.
It is just that viruses in their nature will change.
Yeah.
And they will adapt to the situation they are in. So a virus needs a host to survive.
Absolutely.
It's a protein at the end of the day. So what it needs to do is it needs to change. And this is the beautiful thing about viruses is that it is constantly changing. Therefore, you will find that there will be more newer strains which will also come as well, and they adapt to the environment that they're in. The difference we have with the new strains is that it is 70 times more effective.
Yeah.
Yes, it was affecting more younger people, but it is no longer confined to the younger people only.
Yeah.
And I will give you the picture that we are seeing at the moment, and data that we're seeing in terms of public health. The actual infection started in younger people, but what happened as a result of that was that those younger people were going home and passing it on to other people in their family. Now, unfortunately, or fortunately, as you may want to look at it from a point of view, Asian families particularly are multi-generational families. So we live with our parents, we live with our grandparents. So if I get infected and I'm 24, it may not affect me that much. It's a mild illness.
Yeah.
But my father, who is in his 50s, may end up having complications. And certainly my grandfather, who is in their 80s, is going to definitely have complications, and the mortality there is much, much higher.
Absolutely.
The other difference we have with this strain is that 1 in 3 of us is actually not showing symptoms, but is spreading the virus.
That's right.
So this is where the explosion of infection has come from. We had things under control, or we thought we had things under control, but unfortunately, with the new strains, and we've seen one from South Africa, we've seen one from Kent, we've seen one from Brazil, things have gone topsy-turvy. And we've gone back into lockdown as a result to protect the NHS and to make sure that the NHS is not overwhelmed. Yes, on the whole, the infection is going to be mild for the majority of people. However, if you look at our population in the UK of 7 billion or whatever that may be, if 5% of us were to get unwell, we would not have capacity.
Yeah, absolutely.
So this is where the problem is. The problem is, yes, we can think about herd immunity. We can let everybody get ill. Those who are going to die are going to die. But number one, that's not ethical. Obviously, we have to protect our elderly.
Yeah.
But number two, we will run out of capacity as well. So,
and Rizwan, if I can come in here, Dr. Sab, people have said that it does predominantly affect the elderly. We're talking about, the 80 plus, the very vulnerable people in care homes. And, and I think some people are very callous and very heartless, and they're saying, look, I'm someone in my sort of mid-20s, I've got a business, I've got my job, my mortgage to pay for. Why should I adhere to the lockdown? Because I'm not going to contract. If I do, I'll be able to withstand it. What's your message to those sort of people?
I wish I could take you to the intensive care units, and you could see that people in their 40s are now lying prone on a ventilator.
Yeah.
This is no longer an infection of the elderly only. This is fast becoming an infection of people who are relatively young, people who have very little underlying disease burden. And unfortunately, as a GP, I have seen families getting devastated. I've had a family where an elderly gentleman has passed away who was 75. And 2 days later, his son, who was 35, passed away, and his wife is in intensive care.
Yeah.
It is not an uncommon scenario.
Yeah, most definitely. And just to sort of maybe take everyone back only a week, I attended a funeral of a father who was probably early 60s, and one of his sons couldn't attend the funeral because he was critically ill with COVID at the hospital. So the dad died of COVID, and the son missed the funeral because he was critically ill. And he's probably early 40s, late 30s, around that sort of age as well. So I think we have a responsibility to communicate this. And this is why I wanted Dr. Rizwan to come in here, because I can say until I'm blue, but when a doctor says it who's seen there, been there, then hopefully that will get through to some of you that are still sitting on the fence.
But also to add, though, that the risk factors actually multiply if you are a man.
Yeah.
If you are of a certain age, so over 70s. If you have chronic illnesses like diabetes, which in our Asian population is very, very prevalent.
Yeah.
And if you are from an ethnic minority background. So if we were to look at an Asian population and do a risk assessment, we would already find that we are moderate risk at best and at severe risk at worst if we have underlying conditions. So we're not starting from the same sort of point as the general population. We are starting at a point which is much worse.
Absolutely. And there has been some early indicators to suggest that the black Afro-Caribbean community are 40% more likely to die from COVID compared to their white counterparts. And the Pakistani/Bengali community are 30% more likely to die as a result from COVID due to their white counterparts. I'm just going to read a few comments on social media that have come through. Assalamu alaikum, Ali Saab, and to your guest, Dr. Saab. Thank you, Javed. After that, Javed Akhtar, does the CCG approve new medications that have come to the market? That's one of their responsibilities. I've seen the GPs prescribe less medication and say buy off the counter at the pharmacy. Ali, my question is, have you had a COVID test yourself yet? Alhamdulillah, no, I haven't. I'm not a key worker. I haven't had any symptoms, so in that sense, I haven't.
I will add that I have one every week.
Oh wow!
Because I work in the front line.
Yeah. So Dr. Rizwan, obviously being a frontline key worker, he takes one every week. And have you had the COVID vaccine as well?
Yes, I have.
Okay, so that's reassuring. So Dr. Saab has also had the first dose, may I add, of the vaccine, and Pfizer vaccine, and the next one will be in due course as well. So, wa alaikum salam. Will the COVID test pick up the new variant strains from around the world?
Yes,
absolutely, yes. Do you think we should quarantine people coming from abroad into hotels for 10 days? Bit of a political question.
Yes, I'm not a politician.
No.
I don't run the country. But I think we need to have some sort of means of protecting ourselves.
Yeah.
And I think in terms of quarantining, we need to be consistent in our approach. In order to safeguard ourselves. That's what I would say.
Yeah, no, absolutely. And when the first lockdown happened, Dr. Rizwan, I couldn't believe that our airports were open, that, we were under lockdown, but anyone could come in and out without any tests, without any confirmation or anything like that. And I think, better late than never. And I think even now, especially with this new virulent strain, we should lock down. This is me speaking individually, not even on behalf of Radio Aapki Awaaz. This is something that we all should be doing. Someone should come in with a negative PCR test, even if they do come in here, as Dr. Saab sometimes said that, from abroad, we're not sure about the authenticity of the test. We should put them here as a 10 days at the cost of the taxpayer. That's fine. We're going to get straight into the vaccine debate now. So we know that there's 3 vaccines that have been approved. The first one in December was the Pfizer-BioNTech one. Then it was the AstraZeneca in association with Oxford University. In the last week or two, another company by the name of Moderna have also had their vaccine approved by the UK now. We're just talking about UK here, by the MHRA, which is a regulatory body. And I was today I was picking up on the news, Dr. Rizwan, that next week Johnson & Johnson are going to reveal their phase 3 data. So I'll be, interesting, only because that is again stored at room temperature and it's only one dose, you see. And in total, there's about 300 different sort of vaccines under trial. So over the next 6 months, we will be, bombarded with so many vaccines. But I think in one way it's good, and I think we're the only country, correct me if I'm wrong, Dr. Rizwan, that have quickly license all three, really. I will sort of allow you to maybe spend just 5 minutes really just talking about the all three vaccines, about the efficacy, about the dosage regime, and just their their sort of storage, just for benefit of our listeners, if you can.
So yes, there are not just three, but there are several vaccines on the market.
Yeah.
Worldwide, there is a Russian variant, there is a Chinese one as well, and there are just well over 300 vaccines which are being researched, which are undergoing trials and undergoing approvals. The first thing to say is the MRHA is a very stringent regulatory body, and it would not regulate or it would not approve the data unless if they were entirely sure that these vaccines were actually effective and safe. So the message there is that these vaccines are effective, they're safe, and they are halal.
Yeah.
They do not contain any animal products, they haven't got any fetal cells, and they do not alter anybody's DNA.
Yeah.
And they do not have a microchip in them. That mobile phone does a great job for that, unfortunately, in making sure that people know where we are, and our social media updates usually will inform us of tracking around. These are new technologies. They are bits of the virus, which is essentially the spike protein, which the body then recognizes as a foreign body and starts producing antibodies towards.
Sure.
So when you get the infection and the virus comes into the body, and the body then recognizes the spike protein as an enemy protein, it attacks it with the antibodies that it has created and kept in memory. All the vaccines that we know of, apart from Johnson & Johnson, are a 2-dose vaccine.
Yeah.
So you get majority of your immunity following the first dose, and then you have to have a booster dose after that. And this is not something that is uncommon, because if you look at the other vaccines that we have in childhood, we always need boosters for that. So hepatitis B vaccine is quite similar. We've had to have 3 vaccines within 6 months, and then you have another one in 10 years to boost immunity. So this is no different. There is some discussion regarding this being some very new technology, and how do we know what side effects, etc. they have. This vaccine, the mechanism of this vaccine was developed from the Ebola virus vaccine. The Ebola virus vaccine, if you remember, Ebola is a very deadly disease, so therefore we can't inject the virus into somebody, but we can inject bits of the virus. So the reason why this vaccine was very quick in the development was because we already had all the components. So it's like the iPhone 12. The iPhone 12 is a phone, it has a camera, it has a screen, it has a speaker. But when you come from iPhone 10 and iPhone 9, it's no different, because all the components are there. It's the chip that changes, it's the technology that changes, and it becomes a better, newer phone. This vaccine is no different in that way. We have used a different spike protein from a different virus in a framework which is already existing. That's why it took less time. The other thing is that the trials were taking place at a faster rate, and there was a lot more funding that was put into this because of obviously the emergent healthcare need. So therefore, they haven't skipped any steps. They haven't skipped the safety data or anything like that. There were multinational trials, even looking at trials within Brazil, South Africa, Turkey, China, everywhere. So therefore, some of these variants were also looked at inadvertently, and they work against them. So yes, there are three vaccines. There is the Pfizer BioNTech,
Yeah.
which is a slightly uh, difficult in terms of storage because it has to be kept at -70. But once it's thawed down to between 2 and 8 degrees,
Yes.
you have 5 days to use up all the vaccines. So it is still not as difficult. And yes, it's a two-dose vaccine. AstraZeneca is much easier,
Yeah.
and so is Moderna because they stay in the fridge, just like the flu vaccine,
Yeah.
and therefore they can be given out more easily for people in care homes, for instance, or if you're going out to elderly who are housebound.
Yeah, no, that's fine. Thank you for that summary as well. And in terms of some of the nuances that you picked up, really, two things I'm going to sort of just get you sort of clarify, really, is one is obviously people are extremely worried about that. It seems as though compared to other vaccines or compared to other medicines, this is more or less within 12 months it's been licensed, and that seems to be quite a rush. But I think you just maybe sort of reassure that, I mean, and someone who works in the pharmaceutical industry, that huge amount of resources have gone into this, and also there's been parallel research. People have been working on this day and night. So it wasn't the fact that it was rushed, it was that everything was thrown at finding a cure. And you sort of, and you're not, I mean, you've seen the evidence, you've seen everything that's gone through, and you're not alarmed by it. Hence why, I mean, you're giving it to your patients, but hence why you've also taken it as well.
Absolutely. I mean, if it was something that was doubtful, I wouldn't have taken it myself.
No.
But I was first in line.
Yeah, absolutely. And the other bit I'm going to pick on is, the Pfizer trial, and I think it was AstraZeneca as well. The difference between the first dose and the second dose was 3 weeks, and people are now saying, and after the NHS England and JCIV said that they, in their evidence and in their experience, this is a collective, group of experts and scientists. They said that what they are trying to do is they want the 3 weeks gap to be increased to 12 weeks. Two reasons. One is that they think they will get a better immune response, which I want you to explain as to, not too scientifically, but enough for people to understand. And also for more people to get at least the first dose, because even the first dose, you get between 50 to 70% coverage depending on what vaccine.
Yes. So I think the way the vaccine works is that a vaccine will either be an inactivated virus or it will be a part of the virus which is injected in the body, and that forms a memory within the body itself. So the memory comes in forms of antibodies, and the antibodies is very specific. It's like a lock and key mechanism.
Yeah.
So it's just like a key will only fit a lock, the antibody will only fit a antigen, which is what we are being injected with. And therefore, what it teaches the body is that this is a harmful protein for you, and it forms an arsenal in the memory of the body to defend against this. So when you do become infected and that protein comes into your body, those antibodies are activated to attack them and neutralize them. So that's the way a virus works. Yes, I think the guidance and the trials were looking at either 3 or 4 week intervals. We have to think about the whole country. We have to think about the whole population.
Sure.
Yes, there is some studies and there is some evidence that the immune response is better if you give it time, because it takes time for the antibodies to come. And yes, you need a booster dose, but also what the experts are suggesting is that if we give enough people the first dose where you get the majority of your protection, then we form what we call a herd immunity.
Sure.
Now, this is where I would like to particularly mention our ethnic minority communities. We have an obligation not just to be preventing this illness for ourselves, but also to protect others by taking the vaccine.
Absolutely.
And if we are only taking up the vaccine at the rate of 50% of the community, we are not going to get a herd immunity. We are the ones who are hardest hit by this. If you remember in the first spike, the amount of people we were seeing who were healthcare professionals, and this is the one good thing about the Asian community is that, and we laugh about this, that you are either a doctor or an accountant or an engineer, but we have produced some of the biggest workforce in frontline staff. But unfortunately, we have also lost a number of them in the frontline staff. And it is therefore our obligation now to take the vaccine, and not just to protect ourselves, but to protect others. And this is exactly why one mosque in Birmingham, Al-Abbas Islamic Center, had opened its doors to make sure that we could give the confidence to our own community to say that this vaccine is halal, it is permissible in Islam, otherwise we wouldn't be giving it from the mosque.
Thank you for that, Dr. Rizwan. And I want to sort of come on the bit about the 3 weeks, and obviously also, correct me if I'm wrong, Dr. Saab, is where that, once you had the injection, do not for one moment think that you're automatically immune from any symptoms of COVID. It takes anything between 20, 21 days, 24 days before you really see the body's immunological response to it. So, wait 3 weeks before you're at the optimum or, near its full capacity. Because I know there was some maybe misleading or maybe some different data from Israel that came through which showed that the efficacy after about 14 days was about 30%. And people were sort of using that and sort of people were getting confused. The other thing I want to also mention is that, people have been given the first dose and now are worried about whether we've got enough supply to hit the government's target of 2 million vaccines by middle of February. That's going to be injected. And this is where pharmacists, mosques, community centers, obviously, more GPs need to be trained up in order to be, and community pharmacists as well, in order to hit that 2 million figure. And also, secondly, do you think after today's or yesterday's spat between AstraZeneca and the EU that we have got enough in the supply chain and we won't run out?
So I'll keep out of the politics.
No,
because I'm not a politician.
No.
But we have been assured by the government that there is enough supplies. We are seeing supplies coming through from our end to GP surgeries and pharmacies. So at the moment we're not concerned about the supply itself.
Yeah.
The target was 2 million per week, and we need to immunize 14 million people by the middle of February. And that's the priority groups up to the age of 70, and this is care and frontline workers. So I think healthcare and social care workers and the care homes. These are the people who are at highest risk in the population, and therefore they have been prioritized as a result of this. One of the things I wanted to add, as this is going out predominantly to our communities, which is Muslim community, is that as part of the Green Book, the funeral directors have been classed as high risk because they are looking after COVID bodies and people who have passed away. Unfortunately, in the Muslim community, because we have a culture where we look after our own deceased people, and there are volunteers who are taking part in the janazah, in preparing the janazah, and giving the ghusl and giving the kafan, it is important to cover those people as well. And because they are not under any regulatory bodies, they get lost in there.
Absolutely.
So with discussions with the CCG, we have agreed to make sure that they are prioritized, and we have been in touch with BMBC, which is the Birmingham Muslim Burial Council, to make sure that this information is taken forward, and that we protect those who are looking after those who are deceased as well.
No, thank you for that. And that's just one bit of sort of insight, someone who's within the CCG is able to provide that insight to the clinical commissioning group, who then sort of responded in kind. I know Brother Ghulam very well, and I know a lot of people helping out with funeral services on a voluntary basis sometimes, and it's nice for them to be also precedented and be included in the key worker category as well. So you're fairly confident that, you know, teachers, whoever is in that next category of being high risk, or in that sort of next batch of people being prioritized, we won't sort of run out. And you're not seeing that, are you?
I think, yes, there is a national debate about teachers. There's a national debate about policemen as well. Unfortunately, they are the ones who protect us, but are being spat upon and put at risk as well. So yes, I believe the joint committee for vaccinations and immunization, and also the NHS in its wider leadership, will be are constantly looking at the prioritization of those who need the vaccine.
So that's fine. Thank you. We're going to just come to some of your comments, and then what we will do is go to some of these mythbusters or some of the concerns that you have, and we will try to address those by the end of the show. Sardar, walaikum salam. Javed Akhtar. How many variants? Okay, there's too many. How long does the doctor feel we will be in lockdown till? Interesting question.
The simple answer to that is Allahu Alam. I don't know, because like I said, there are always going to be new variants of the virus. We also need to make sure that we protect enough people within our society before we can lock down. And this is where I can not reiterate the message that the Muslim community and the ethnic minority community, be it black, be it Asian community, do need to get protected with the virus, because if we don't, we will be letting ourselves, but more importantly, our community.
Absolutely, well said, Doc. Thank you, Dr. Saab, for coming on to the program and giving advice, which is very valuable. We salute you, Dr. Saab. Every blessing and rewards for you. It will be Ramadan soon, in a couple of months. Vaccine still may not be complete by then. How are we going to vaccine the Muslim community in particular if they are fasting? That's a good question, actually. I haven't thought about that.
Well, yes, it is a very good question. And maybe this is where the 24-hour vaccination centers will come into play. But I think there is a real need for the Muslim community to get actively involved in the vaccination program. We have already missed out on one Ramadan last year. We are more likely going to miss out on this Ramadan. And Ramadan is a very, very special time for us as a community. We fast together, we pray together, we eat together. Families become more united. And this is where, unfortunately, because of the virus, we've had to shelve everything. Yes, our mosques have responded in kind with online programs and online initiatives, but it isn't quite the same.
No.
And this is why I think we have to be in the forefront, by challenging fake news, by saying yes to the vaccine, and by getting ourselves vaccinated.
Yeah, no, well said. Bit of a alam type of question. He said, "Are we able to take a vaccine while we're fasting? If you think you can, answer it, please do. If not, I've got Dr.
I'm not an alim.
No, that's fine. My understanding, limited understanding, is that if you're fasting, then you can't take a vaccine. But please ask your local mosque or alim to answer that, please. You will break the fast. My understanding is. Assalamu alaikum, Brother Mujahid. So, are we okay to go through some of these myths? And I think this is what a lot of people were sort of talking about. Was, first of all, people have been really taken in by the fact that this vaccine, it's an RNA vaccine, will change people's DNA. And I want Dr. Saab just to sort of clarify that once and for all. Really.
Okay, so the RNA is a transport protein. It's not part of your DNA. It is a carrier protein which translates the... it's a bit complicated in the sense that a DNA is a blueprint of the cells that we require in the body. So when you require the cells, you go to the blueprint, you start manufacturing the protein structure of the cell, but you need something to hold the proteins together. And that's what the RNA does. It holds the proteins together and it binds those proteins together to form the cell that you want to make. The RNA doesn't become part of the blueprint. It is only a mechanism where the new protein is made. So it doesn't alter your DNA. We're not going to have monkeys for babies or anything like that. So it's not going to change any of our genetics at all.
Good, good. Okay, I hope that reassures everyone. Also, people are really worried about the long-term effects because a lot of these trials are for possibly for 1 year. People are thinking, what will happen after 18 months, 24 months as well. Are you able to reassure our listeners about these long-term effects of these COVID vaccines?
So I think, yes, they are new. They are new vaccinations. But like I said previously, the concept of the vaccination is not new.
Yeah.
The mechanism of how the vaccination was developed is not new. And going back and looking at other vaccines of a similar kind, there have been very little, if any, long-term effects at all. So we would have had TB vaccines as soon as we were born as ethnic minorities in this country. We would have had MMR vaccines, we would have had polio vaccines, etc., etc. We even have hepatitis vaccines if you work in the healthcare field,
Yeah.
or if you're traveling frequently. But none of this alter your DNA or have any long-term effects as such. So yes, even though we're learning about the vaccine, so one of the things we learned about the Pfizer vaccine, for instance, is those who have got lots of allergies, who carry EpiPens, perhaps should not have that vaccine.
Absolutely.
But as soon as we found that out, we made sure that those people were identified and had the AstraZeneca vaccine, which was safer for them. So active steps are being taken in recognizing any long-term effects.
Yeah.
But as far as we know, there aren't any.
Okay,
Or
good.
very, very, very little.
And people are thinking about how long will the immunity last as a result of taking both doses. Do we need a booster every year, or is this going to last for a year? Has there been more information been released by any
Not
authorities?
yet. I think at the moment we are not sure as yet. It is likely that this may become part of a yearly vaccination campaign like the flu, but the jury is still out on that.
Yeah, that's what I'm sort of also hearing, that it may be an annual event. But the more patients we have on, the more data that we have, then that will be able to allow that to be understood. So we've talked about. There's also some, information going around that if supply is short, one of the scientific officers said that at the worst case scenario, we may mix and match. So your first dose was maybe Pfizer. If they can't get hold of the second dose, because you can't pick and choose as a patient which one you're going to have. So, for example, if I come to you to get my vaccine, you will give me whatever is at your disposal. So, as a patient, we can't pick and choose, and not that we should, because they're the experts, and there's not much difference between the two. But they said that the second dose may be of another one. But what are your thoughts about that? Or would you be comfortable with that?
I think at the moment the aspiration is that we are going to give the same vaccine for the second dose as we've given for the first dose.
Yes.
Certainly the studies have been for the same dose of the vaccine. Now, I haven't heard the fact that any scientific advice so far regarding mixing and matching vaccine. In fact, as far as I'm aware from the medical press, the advocation is of the same vaccine to be given for the second dose as was for the first dose. And the national system, which we record all our vaccinations, are actually quite stringent in making sure that we are giving the same doses as well.
Yeah, thank you, Mujahid. We've almost preempted your question, actually. We've already answered it. So whenever you go to have your vaccination, you will be given what's there. The doctors will give you what they have available. As a patient, you can't pick out of the three now which one. Well, the two main ones still that are in supply, which one you can choose. So I hope that clears that up.
And just perhaps to add to that, it's about the supply.
Yeah.
So it's better to be vaccinated with the vaccine that is available than to wait for a vaccine which may take a while, because the time that we're waiting, we are still susceptible to infections as well. The other thing is that The supply will vary depending on where you have your vaccination. So for mass vaccination sites where they can use up the 975 doses in one batch of the Pfizer vaccine, that will be where the Pfizer vaccines will be. But with GP surgeries and the storage capability of not being at minus 70 and the ease of storing, you're more likely to have an AstraZeneca vaccine or a Moderna vaccine.
Yes.
In those settings.
And moving on, Dr. Saab, we've had a lot of debate and misinformation for those ladies in particular who are maybe trying to conceive for a child or maybe a childbearing age, that they shouldn't take it because it will affect their fertility. Can you please address that, please?
So again, there is no evidence at all that it affects fertility in any way. Yes, if you're pregnant, then speak to your doctor. If you're breastfeeding, then speak to your doctor. But there is no evidence to suggest that this affects the fertility of anybody at all.
Yeah, and I hope that answers a couple of your concerns. The other one was, I know doctors already mentioned that all three of them do not contain any animal ingredients, because I know people were saying that, pork's in there, animals in there, it's been tested on embryos. But luckily we had the BEMA, I can't remember what it stands for, actually,
British Islamic Medical
Association. So BEMA have sort of endorsed all the vaccine, and they said that, it is ethical, it is Islamic, it is halal for us to have these vaccines in our system as well. So, these are, Islamic, and they're medical people that have sort of made that decision as well. So, and you've also got Dr. Rizwan, who's also echoed that as well. So I hope that reassures you. I'm now going to sort of touch on the bit about, you mentioned about, about 50%. There's some studies, research, anecdotally, where they say maybe the Afro-Caribbean, maybe as high as 70% have said no to these vaccines. I just want to sort of spend maybe a couple of minutes just exploring that, because I think there's sometimes, we are sort of, as Asians, are harder to reach a community when it comes to engagement and having trust with the NHS. I suppose you've seen that with, the high number of disproportionate equality that we have between the healthcare outcomes between a normal Asian person and maybe a middle class rural white counterpart. So there's been a bit of a gap already, but now with this death from COVID, we've seen a big increase within the Asian community. We've seen a low uptake as well. Hopefully this will not only we're going to get more people on there, but hopefully this will kick on a lot more research, a lot more investment into deprived BME communities.
Well, I think the CCG does care about the ethnic minorities. The CCG is working very hard to work with ethnic minority communities. The surprising thing is that it is the ethnic minorities who are being affected the most by COVID. And the long-term effects of COVID, particularly long COVID, as we call it, are also quite devastating. And they're probably much more devastating than any of the long-term effects that they may be presumed from the vaccine itself in the first place. The blessing of Allah for those of us who live in this country is that we do not have to pay anything for the protection that is provided to us by the government. Yet, it is probably, and I include this in this myself as an Asian and as a Muslim, that we step back when we are being given the opportunity to be vaccinated or to have protections. And this is not just with COVID. COVID has only exacerbated the inequality in the Muslim community. But to get a Muslim man to come for his NHS health screen when they have a high proportion of diabetes in the community is virtually impossible. Or for them to have the flu vaccine, to the point that sometimes as commissioners we have to think about getting a bus and coming to the mosque on Friday for Jummah to start giving people their flu vaccines every year, or to have screening programs in Ramadan in mosques to check your sugar and cholesterol because everybody is fasting. it is our responsibility, and one of the things that Allah has given us is our health. And I strongly believe that one of the first questions that we're going to be asked on the day of judgment is, what did we do with this ni'mah? Because if we didn't look after it, then we are answerable to Allah.
And I suppose the other sort of flip onto that point is people say, oh, everything is predetermined. We know when we are going to die. So, a lot of my relatives, when I ask them, please quit smoking, because I think there was that data where each time you smoke, it takes out a certain amount of days. And they said, look, doesn't matter, we'll die when Allah is written. So this smoke.
Yes, I agree, we'll die the day it is written and not a second longer. But that doesn't mean that we don't go and look for a cure or for protection. In the infinite mercy of Allah, it is said in a hadith from the Prophet ﷺ himself that Allah has not created a disease for which He hasn't created a cure before, except for death. So it is irresponsible of us to say that we are going to die when we go. We, of course, Malikul Maut has got a given time, but even Allah, in His infinite mercy, can extend that time or reduce that time because of the actions that we take.
Yeah, no, absolutely. Very well said. I think very well explained as well. Moving the conversation on to children now. So at the moment, we do know that they are very unlikely to contract this particular COVID disease. And even if they do, they aren't going to sort of die from it, or they aren't going to sort of show huge symptoms. So obviously, at some stage, we are going to be opening schools up, whether it's in February, whether it's in March or beyond. There are going to be some, regular weekly tests that the children are going to be undertaking as well. If you've got, I don't know whether you've got young children, at some stage, do you think they will be vaccinated? So I'm talking about maybe in a couple of months' time, 14, 15, 16, 17-year-old. And what's your thoughts about that as well?
I mean, at the moment, there are no plans for children to be vaccinated, simply because the disease burden is very, very low.
Sure.
And even if they do get the disease, it's a very mild illness. I think the priority still remains in vaccinating all the adults, and especially the older adults, because they are the ones who have the most amount of complications with this virus.
Yeah.
So it's rightly so that the prioritization group has worked that way. I don't see children being vaccinated, not this year anyway.
Yeah.
Unless, of course, they've got chronic illnesses, or they're immunosuppressed, or they have got a weak immune system, then there's a different question.
Yeah. And I just sort of recall last week, one of my relatives who is probably in his mid-70s, and he was asked to turn up to his vaccine appointment, and he refused. And that's his decision. And he then, within his circle, he told about 8, 9 other people who were over the age of 60 and had some sort of underlying conditions, and he told them, there's a chip in there, and don't take it. They're going to kill you off. And he said it, and all 8, 9 of them refused and declined their appointment. Some of them actually phoned, said, look, we're not going to come. Some just didn't turn up as well. And I got to, these are my family now, my first cousins, and I heard about it, and I was very disappointed. And I sort of felt disappointed because in my cousins, I should have, told them. So anyway, I phoned a few of them and said, look, what's the matter? What evidence have you chosen to decline the appointment? They said, no, so-and-so said, and we're not taking it now. So I then phoned that person. I said, look, this is what's happened as a result of your actions and your words. And he goes, oh, I just said it flippantly. Someone told me off the street, and I just passed it on to whoever I was meeting.
Yes.
And he didn't realize they had declined it, so he felt very guilty and sheepish about it. I said, you don't take it, but let me go and convince them. And literally took, Doctor, so I'm not having any pulling your leg, but a minute just saying about some of the the pros of taking the medicine, and they said, oh, okay, we'll book an appointment.
Yes. Yeah. So I think as a CCG and as surgeries and vaccination centers, we would be quite happy to rebook those who change their mind.
Yeah.
But we have a big bala in the community that's called WhatsApp.
Yeah.
And unfortunately, this is where people forward messages irresponsibly without even having a fleeting thought. And I'm guilty of that as well, because I'll see something and I think, oh, I'll put it in my family group, or I'll put it in my friends circle group, or put it in whatever other group that I want to put in. But we don't think about the consequences of our action. Just to reiterate about this microchip, I have been vaccinated, and so far nobody has controlled me, not even my wife. And to be fair, there are easier and much better ways of controlling somebody or finding out their location. You just have to use a mobile phone these days, and everything is location enabled, and you're beaming your position. Even my wife knows where I go because of Life 360. She knows exactly where I am at any given point in time. So yeah, I think, to be fair, that there are much easier and better ways of tracking somebody, and I think it's just a myth.
Well said, Dr. Let me just read a few questions to that. Mujahid's good question. Some schools will be testing teachers twice a week, yes, and also children as well. I wonder if the people who refuse can change their mind later on. I think Dr. Saab said, please do phone your GP.
Yes.
And get yourselves rebooked in.
So for vaccinations, you can either book online. You can go on the UK website, and you put your details in, and it will tell you whether you're in the prioritization groups, and you can book that. One of the things I would probably ask is that don't turn up for your vaccination late, but equally don't turn up for your vaccination early either. Because obviously for social distancing, people are spaced, and therefore those who are keen, I'm glad that they're keen, but just please come on time rather than early or late. But yes, you can either contact your GP, or you can go online, and you can get your vaccination from a variety of sources. It doesn't just have to be from your GP. It can be at your GP surgery. It can be from Millennium Point. It can be from any of the other initiatives for the vaccines. I'm sure your GP will not mind.
Absolutely.
We will not be offended in any way. It's a mammoth task, and it's all hands on deck.
Absolutely. And it's not every GP that at this stage is doing it. So here in Alam Rock, we have the Closure Road walk-in centre that's doing it. And I think also Amana Medical Centre, and also not too far in B9, Iridium Medical Centre on the Borsig Green Road. They are some of these chosen centres that are delivering that, as well as we're going to spend a few minutes just talking about the mosque as well. I was really really proud when that came on the BBC Midland News, so we will touch on that if I can. Javed Akhtar, we are so proud of you guys. Really super program again. Thank you very much, sir. Thank you very much for your positive messages. Really appreciate that. So moving the question on now with we mentioned about trying to get to 2 million vaccines. I was surprised, and also at the same time very proud when a mosque on Clifton Road around sort of Sparkbrook Way came in the newspaper. I think it was Stephen Jenrick, one of the ministers from the government, was there. You were there. Sheikh Nuru was there as well, and they were talking about how they managed to utilize the space of the mosque to primarily address and encourage people to uptake from the BME and the Muslim community the vaccine, and do so in a local setting. When you have to travel maybe 4 or 5 miles and you don't have the transport or anyone to give you, that's just another excuse. But here, for people living around that area and that maybe praying in that area, you were there, and for all people that were listening, it was super, because one, we were doing something positive. We were encouraging more uptake as well. Can you just maybe, I've got Sheikh Nuru coming in next week, but maybe just from your point of view, how did that come about? And if there's more mosques that want to sort of go down that route, how would they go about doing it?
Yes, so I think whilst the credit goes to Awaaz Islamic Center, but the credit also has to go to the Masters Group of Pharmacy as well. So this came about because the Masters Group of Pharmacy, who are part of the congregation, thought of applying for becoming a vaccination provider with NHS England. And they were inspired because of the space that was available at the mosque, and because the mosque is closed at the moment because of COVID,
Yeah.
to use the mosque to give a positive message to ethnic minority populations and to encourage them to come and get the vaccine, because it is vitally important that these are the people who need the protection the most. I'm quite proud to say that as an executive at the mosque, when the idea came to us, we jumped at it, because I think it's a firm belief, and Hazrat Ali says that people are of two kinds. They're either your brothers in faith or your brethren in humanity. And I firmly believe that service to Allah is not complete without service to your fellow human beings. And this was the inspiration really that we took in order to make sure that not only the vaccination center was open to our own community, the Muslim community, in the wider sense, but also to the whole of the wider community. And Alhamdulillah, I have been to the vaccination center several times now because of all the media engagements with Robert Jenrick, and today Andy Street came to visit, and we've had various dignitaries, some sent by the Prime Minister himself, to come and make sure that they were supporting this initiative. I have seen people coming from Redditch, from Bromsgrove, from Solihull, from Moseley, and from Shirley, and all those areas, because the earliest appointments they could find were at the Al-Abbas Islamic Center. And in fact, it was the first time for quite a few people to come into a mosque.
Wow.
So not only have we done a service to humanity, but we have also used this opportunity to do a da'wah and also counter the Islamophobic attitudes that are widespread, that Muslims only look after themselves, Muslims are introverted and introspected, and I think it has created it's created a lot of work for us because of media, but it's also created a lot of positive sort of publicity for the mosque to have done that. And I'm really proud to say that once we started the way, a lot of other mosques have jumped on this initiative. There have been various calls from various mosques, not only in Birmingham, but all over the UK, asking us how we went through the process, and we're quite happy to share that with you. There is no secret. I think the more we get these initiatives, not just in our mosques, but in our synagogues, in our churches, in our gurdwaras, in our mandirs, the better it is for us, because we're protecting as many people as we can. And faith communities have got a big part to play in this initiative.
Yeah, I like the bit about that. You weren't just focusing on the Muslims or your own congregation, that you wanted to vaccinate anyone that needed a vaccination and they was in that sort of high risk category. You opened the doors for them as well, and what a fantastic gesture. Were the CCG involved at all in this initiative? Or
the CCG is always involved, but the NHS, this was an NHS England initiative with pharmacies, which took precedence.
Interesting. No, I've been asked by at least 2 or 3 mosques to sort of try to explore and maybe even do a visit. And I'll probably either arrange that with yourself or or Mr. Sheikh Nuru, who's coming in next week. And they're quite keen to replicate that one. Actually, hopefully, if they all get signed off, a mosque in Alam Rock as well. So, huge gesture that will be.
And to be fair, I think when I was part of the Masjids group meeting on yesterday, we had this discussion with a lot of the masjid executive teams on how this can be done. But also, I'm quite proud to say that a number of masjids have taken up the role of doing lateral flow tests, COVID tests as well. And that is also equally important as well. So I think there is a lot more that the Muslim community can offer, and there's a lot more to come, particularly within the Birmingham sector.
Yeah, absolutely. We've got about 4 minutes left, Dr. Saab, before we come to the end of the show as well. So please, if you've got any last few comments, please get them in before we finish. One point we're going to make before we sort of go on to what the future looks like is people are also saying a lot of the GPs, the healthcare professionals are in it for the money. They're doing it because they get, I think, about £12.50 per injection, I suppose just sort of maybe put the other side that this is, a lot more work and it probably costs you a lot more money than people.
I think if you are in this to earn money, you're in the wrong business. Because I think £12 doesn't go a long way.
Yeah.
I mean, just to give you a bit of insight about general practice and how it is funded, and there's always a misconception about this, and I think when I say this, people get quite surprised that what GPs get to look after a patient is usually around about £120 a year. And that's the budget we have. And we rely on the fact that the majority of our people are not going to become ill. So we use some of that funding to cover the ones who do become ill. And this is how we sustain the economy. The same with COVID vaccines. It's a cost neutral exercise because we have to have nurses we have to pay for. We have to pay for all the bills and all the activity that takes place, the reception staff, the other healthcare assistants, the doctors, the nurses. We don't make anything at all.
Yeah, absolutely. I think you're right. If you are going to be, if you're money oriented, the NHS medical professional is not the job. It's not the job to be venturing down. Towards the end, as always, I like to end on a positive. But before we do that, I'm going to ask Dr. Rizwan maybe to sort of give us a bit of a horizon scanning, if you can, maybe what the next 3 months, 6 months looks like, in terms of the vaccine, in terms of the numbers. I know you don't have a ball, but if you can maybe just crystal gaze, and in your expert opinion, what do you think, we can do if we all abide by the lockdown rules as well?
Yeah, so I think, all I can say is Allahu Alam. I think there are challenges, but there are opportunities as well. And the biggest opportunity at the moment is the fact that we have a vaccine that is effective against all the strains, and that this is the only light at the end of the tunnel. And believe me, this light is not an oncoming train. It is it is a ray of sunshine. And we are hoping that if we get enough people vaccinated, we start sustaining some sort of herd immunity where we have got at least 70% or more of the population vaccinated. Then we can start easing the restrictions, and then inshallah we can start going back to some sort of semblance of the new normal, whatever the new normal is going to be. But this COVID is here to stay. It's going to change our lives, and there is no two ways about that. Unfortunately, nobody can do anything about that, but we can only go by what we have in terms of an arsenal to combat this, and inshallah we will get to the other end in safety. And I pray to Allah subhanahu wa ta'ala to keep us safe in this outbreak and pandemic. I know that we have lost a lot of people, and I know that there was a situation where we were digging mass graves in having 10 bodies buried together in one grave. And that is a heartbreaking situation, and that is something that we can avoid. And we can avoid by making sure that we follow the guidance and we have the vaccine.
Yeah, well summarized, Dr. Sam. I'm going to just sort of again finish off by saying, for those of you that are fortunate enough to be vaccinated, first of all, salute to you, because you are in one way providing confidence to those that are sort of in that 50-50 or have been put off by the misinformation that's going on. So please, reach out to the experts, listen to what they're saying. If there was anything in this vaccine, they wouldn't be injecting themselves or their patients or their loved ones with this vaccine as well. This is the beginning of the end, hopefully. And for those of you that have been vaccinated, that doesn't mean that you can't still social distance. You should still social distance it, because that doesn't mean that you can't get COVID. You can. All it means is that you are less likely to get the very severe type of COVID. That means that you will be admitted to hospital. So that's the whole essence of the drive by the government and the NHS to get 2 million people vaccinated by the middle of February. So today we had Dr. Rizwan Alidina, who's a GP and also who is a part of the clinical commissioning group for Birmingham and Solihull. Next week we are going to delve a bit more deeper into the initiative that the Mosque Al-Abbas over in Clifton Road in Sparkbrook, who Dr. Rizwan is associated with, will talk about more about their achievement and how that was set up as well, to encourage and share best practice for other people that want to go down this road. And the week after, I've got the lovely personality that is Dr. Imran Hussain, who's a GP. He did his show 3-4 weeks ago in English, and now we're going to do the same show as promised, because this is something that you wanted in Mirpuri as well. So if you've got a lot of people that can't speak English, your elderly parents, your aunts, your uncles, some of your partners that may have come from abroad or for whatever reason, on the 2 weeks time, Dr. Imran will be doing a show exactly the same thing that we did about 4 weeks ago, but in Mirpuri. On that note, as always, we are now seeing a small tail off, small decline in the number of cases nationally, but more importantly, locally here as well. But we still need to make sure that we adhere to the lockdown. Do not be one of those that are seen partying, are breaking lockdown rules with, going to engagement parties or small little weddings or anything like that. Maintain your 2-meter social distance. Wear a face mask whenever you go outside, and wash your hands as much as possible. We are in this together, hopefully we will see the end of lockdown sooner rather than later, but the early signs are that this may be extended till about March, April as well. So please, I know it's tough, we are getting fatigued, but we need to rally and support each other as well. So on that note, from me, once again, a huge thanks to the fantastic work all our NHS colleagues are doing, and all the ones that have paid the ultimate sacrifice as well. May they be rewarded in the next life as well. So Dr. Saab, we will want to call you again, maybe just after Ramadan, maybe just to sort of give an insight into the Al-Abbas and also the CCG work as well. And on that note, just want to sort of give you once again huge amount of thanks for the fantastic work that you are doing. Allah Hafiz, take care, and see you next Tuesday. Allah Hafiz.